cases of COVID-19 are, yet again, on the rise. The U.S. is seeing an average of more than 100,000 reported new cases across the country every day. That's nearly double the rate a month ago and 4 times higher than this time last year. And the real number of cases is likely much higher than that, according to health officials. Because many people now rely on at-home tests, we're clearly undercounting infections, White House COVID-19 response coordinator Ashish Jha told reporters at the most recent COVID press briefing. Hospitalizations are trending upwards too, though only gradually in most places. Yet in most places, health officials haven't called for any new COVID restrictions. So how big is the surge, really? And is there anything you should be doing about it? Official undercounts of cases are not exactly a new problem. At the beginning of the pandemic, many cases went undetected because tests were unreliable and supply was limited. We saw early on, in March 2020, that maybe 1 in 10, maybe 1 in 12 infections were actually being captured, says Jeffrey Shaman, an infectious disease specialist at Columbia Uni. Very early research efforts to figure out how many infections were out in the community involved testing a sample of residents for SARS-CoV-2 antibodies. As the pandemic progressed, that method didn't work as well, Shaman explains, because antibodies after infection waned over time and because vaccinations complicated the antibody picture. Shaman's research group turned to using models to estimate the ascertainment rate, the portion of real infections that were being captured in official case counts. That rate has fluctuated. At the end of 2020, they estimated 1 in 4 cases were being counted. During the Omicron surge it was closer to 1 in 6. Now with the advent of at-home rapid tests that aren't reported to health departments, Shaman thinks the true number of cases may be in the ballpark of 8 times higher than case counts. In other words, instead of 100,000 new cases a day, the true number may be 800,000 cases per day. Take that estimate with a giant grain of salt, he advises.